there seems to be some conflict or discrepancies between the two principles, one of them being sovereignty, in which someone has the right to choose what they want for themselves and what they want to happen to them, and the concept of non-malfeasance, which is not wanting harm to happen to someone, trying to avoid all negative effects and trying to get the best outcome possible.
Sure.
And the topic that we've kind of come here to focus on is euthanasia, which means good death. And we're just trying to figure out, as an ethicist, in your professional opinion, the conflict of those two pillars. How does that create a belief, and how would you, keeping in mind those two concepts, how would you approach the topic of euthanasia?
Yeah, you really framed the dilemma quite well. So, what you call sovereignty, I call autonomy, but I think they're very much the same. So, without the other principles, a person that's exercising autonomy could ask for whatever they want from whomever they wanted, and it would have to be provided. So, if a person wanted all kinds of extravagant treatment to be kept alive forever without these other principles, we'd be obligated to provide that. And likewise, to your point, if a person said, I want you to give me medications that hastened my death, that in fact caused me to die, euthanasia, that with only the principle of autonomy, then the healthcare would be obligated to provide that. But it's these other principles that provide the tension and the balance between sort of the all-powerful autonomy or sovereignty, which is a term you used. There was actually a court case, Vacco versus Quill, where a patient was suing to try to get the mandate of physician to participate in euthanasia, of killing them. And this went all the way to the Supreme Court, and it was decided physicians are not constitutionally obligated to cause someone else's death. They don't have to. It's not obligated. And it states that states can pass laws against euthanasia if they want to, but they didn't say that euthanasia is illegal, because some states have chosen to enact laws. So that's a little bit of the legal balance of it. In terms of the principles, and you talk about non-malfeasance, doing harm, I think that the question there is, is death harm? And some would argue that we have to keep a person alive no matter what the cost, no matter what effort, whereas others believe that, well, death is not the worst thing that can happen to a person. I'm of the opinion that those that say we have to do whatever is possible to keep someone alive, regardless of the pain or suffering that they might be in, has probably never experienced very much pain in their life. Because pain is a horrible taskmaster. And there comes a point in the treatment that if we cannot control the pain without risking the life of someone else. And the ethical theory there is what's called double effect, which means if the intent is to treat the pain, and in doing so, a secondary effect, the double effect, the secondary effect causes a person, say, respiration to drop below life-sustaining levels, we accept that as ethically okay.
Because the goal is not to kill them.
The goal is not to kill them. The goal is to control the pain. And so that is the balance of autonomy, beneficence, doing good to control the pain, and just trying to weigh those out. Does that speak to your question?
Yeah, how you were able to explain that really justifies how the principles and the beliefs that people have should be taken into belief and consideration.
Absolutely.
And definitely sheds major light on the definitely the controversial issue that is euthanasia.